All right, good afternoon from Sabre Nation. This is Colonel Epperson coming to you live to do a virtual town hall. I have with me Command Chief Stephanie Cates, as well as I have Dr. Lastly that is here to help me field any kind of medical questions that we may have today. So since our last time that we met for the town hall, what has changed? We are now at HP condition Bravo. I made that decision earlier today in consultation with our public health and our medical professionals. We've been closely monitoring the situation here, and recently in the past day or so there has been an increase in the number of cases that we have had in the local community. We're now tracking in our surrounding communities about 43 cases that have been confirmed. At this point, we still have no confirmed cases here on Spangdahlem or within the population of our base and our family and our communities here. But out of the, based on the fact that it is in our outlying neighborhoods, that we felt that it was time to go to health condition Bravo so that we now start using some more stringent means of protecting ourselves from the spread of this virus. I released a letter that you can find either on Facebook, or I posted it out through command channels as well and a base-wide email that says exactly what we're talking about here. The big things that we are starting to adopt is we're going to be doing physical distancing. You can tell right now I'm not side by side and we're not all in one camera view because we are adopting those social distancing practices. With that, what we're talking about is staying 6 feet apart from each other and maintaining separation. We're no longer doing the shaking hands or bumping elbows, but air high fives, so those are still full up.
Like that.
You can do those anytime. This isn't to take away the social aspect. We are humans. We need the context. We need to be talking to each other. We need to be reaching out to each other, just not physically touching each other. So keeping our distance as we move forward. Additionally, we're making sure that we stay in line with what the Center for Disease Control stipulates, which is, they have said that we are supposed to reduce our gathering sizes to less than 15 personnel as we're moving forward. There have been, just so that everybody is aware, I know that there's been a lot of questions about, hey, do we have cases here on Spangdahlem? Are we testing for cases? So our medical professionals via the public health hotline have taken a number of calls about symptoms and other things. They go through a list of questions. They assess the entire situation, and in accordance with Center for Disease Control guidance, then we do put people in and have them tested. So we have tested a number of personnel within our community here at Spangdahlem, but to this point, as I said, we have received all of those tests back, and they are all negative at this time. But we need to, adapt how we're operating here in order to make sure that we ultimately protect each and every one of you, we limit the spread, and we preserve our capabilities to execute our mission here at Spangdahlem. There are a number of restrictions that are going to go in line with this. I know that there's going to be a lot of questions here, but we are taking measures. Our restaurants, our food places will be open, but they are going to be for to-go food only. You're going to see that the tables are being removed out of restaurants so that you don't have the temptation to stay there and to eat or to congregate, but you can go in and get those services. The commissary and the exchange, those will stay open. Over time, the hours may change, but right now we're keeping those open to the max extent possible so that people have the ability to get the things that they need and to stay supplied throughout this. Things that will close. We're looking at the church services will probably go to a virtual service versus an in-person service. You're going to see that a number of the large gatherings, for instance, our Road to War brief for the exercise, is not going to be happening in person in the theater tomorrow with 500 of your closest friends. But we will look at virtual ways that we continue to do these things. I ask that each and every one of you in your own workspaces look at the meetings that you need to continue to have and then look at which ones you can slim down or turn into a virtual meetings. I'm doing that with the wing staff meeting. You're going to see some guidance coming out later today, but we'll have a Meet Me phone line that we'll dial into, and we'll be able to talk to each other that way so that we continue the business of the wing and the mission of the wing moving forward. I know that there's probably some questions as far as our childcare facilities on base and some of the decisions that I've made to keep those open through Friday. So at this time, like I said, there is no positive cases of COVID-19 within our population here at Spangdahlem. If that changes, then we may have to close those sooner. But at this time, I'm trying to provide the maximum flexibility for families as well as supervisors to work out either the teleworking or the backup plans so that people can care for their children and make sure that the family is not put in undue stress. So that's what we're doing there. As far as medical appointments go, medical and dental appointments are going to continue through Friday, so they will see who they can before then. After that point, we will be switching to an acute care, necessary recurring care, as well as pre-deployment care visits. Those three things are what we'll be limited to in an effort, again, to limit our spread of the coronavirus. What I ask is, if you don't know whether or not you meet one of those categories, you can call the appointment hotline, and they will be able to tell you whether or not your appointment is going to continue or not. But these are ways that we can help to mitigate the challenges that we're going to have here with COVID-19. With that, I'm going to hand it off to Chief, and she's going to say a few words, and then we'll open it up for questions.
Thanks, boss. I just want to say hello to all the savers out there watching. Start off by saying thank you for tuning in. Thank you for your questions both previously, and we look forward to answering some of your questions today and in the future. We want to always stay in touch with you. So thank you for tuning in. Thanks for your questions. Also, thanks for your continued patience with us. I'm sure you've all heard a lot about, we heard some guidance, and then guidance will change, guidance will change. The shortest way to say it is guidance is continuously evolving, and we are working hard to stay on top of it, get you the most updated information. Our public affairs team is on top of it all day, every day. They're doing a lot of work behind the scenes to keep our Spangdahlem website updated, our app, our Facebook pages, on and on. So we're trying to keep us focused on the right resources so that we're all going to the same place for information. But just wanted to say, we'd like to encourage you to continue to operate from fact rather than rumor. There's a lot of information flying, some of which is around as accurate, and some of it is maybe a little bit less accurate. So for your most accurate and up-to-date information, we want to keep you plugged into our Saber Nation resources. But I just want to say thank you for that too. And then lastly, thank you for continuing to take care of each other. Schools are out, families are starting to find what their new normals are. And as we start to work on telework and meetings, virtual meetings, that'll be a little bit different for all of us. So we're all going to have a new normal here in the coming days and weeks, and so just encourage you to continue taking care of each other. Touching base digitally, maybe no high fives or elbow bumps as the boss said, but there's still plenty of ways to stay connected. So I want to make sure that we'll be establishing probably new different types of connections here in the coming days, and just want to make sure that we stay strong as a Saber Nation family and stay calm and stay strong. So, yeah.
Thanks, Chief. So absolutely, a couple things that I forgot to mention that I'll hit here real quick. The first one is what's happening in our local German communities. There was guidance from the German central government. They said that they have left it up to their own communities to determine exactly what it means, but they need to start limiting those connections and start to do physical distancing. So different communities have different things, but what you're going to see is a lot of the services will continue, but a number of retail shops and other kinds of things are going to be closing down. Some have restrictions on restaurants of how many people can be in those restaurants. They'll have to be physically distanced inside of the restaurants. Other locations, the restaurants are actually closing. But through all of this, you can count on it. You're going to have medical care, we're going to have pharmacy support, and you're going to have grocery stores. Everybody knows that the main basics of sustenance need to continue. The supply chains are continuing to provide material, so you can expect that as we move forward. The last thing that I'll say that I forgot to mention earlier is that USAFE Africa has pushed down the ability to telework again. I signed the letters yesterday, both for our civilians as well as for our host nation partners. Roland and I signed a agreement between myself and the Works Council so that also our host nation employees can start to telework. Those should be decisions that are made between the supervisor and the individual. There's training that's required and there's things that need to be provided, but that is out there. Military-wise, it is up to your supervision and your leadership to determine who can telework, but we're going to start to alternate. We've already looked at up here at the wing. We're going into that starting tomorrow, where we're going to have, some of our staff will be working from home, and we'll have the minimum that we need up here in the office to continue the mission going. And with that, I'd like to open it up to you guys and hear what's on your minds.
Will we still have the base exercise?
So that's the hot topic that everybody wants to know. And the answer is yes, we're continuing on with the exercise. However, it's going to be in a quite a modified form. And I'm not going to get into all the details in this forum based on operation security. That will be coming out through your leadership. But we are absolutely going to be modifying the hours, we're going to modify the scope, and we're going to modify a number of the things that have large gatherings so that we can come in line with the physical distancing and the guidance that we have for operating under HP Con Bravo.
And something I'd like to highlight on that is we've talked a little bit in recent weeks about Sabre Nation being Innovation Nation. I think this is a great opportunity for us to think outside the box as we start to accomplish and need to accomplish some of these exercise items. There's some task items we're looking to tackle, and I think this recent set of events has given us some new challenges that we can, maybe we weren't originally going to plan to get after, but now we've got some opportunity to think outside the box and operate differently than maybe we had originally planned. So I think it's a positive. It'll still go, it'll just be a little bit different than what you might have seen in the last couple of exercises.
You bet, Chief. She's absolutely right. We've already been talking with both group leadership. We got their inputs today. We've talked with the IG as well as the plans shop. The one thing that I can tell you we have done, we are not going to execute the portions of ACE that were off of this base, so the exercise will be contained to Spangdahlem Air Base itself, so that we're not opening up to the larger population there.
What happens if I can't return from leave?
Okay, if you can't return from leave, I know that this is one that we are continuing to work on right now. We've been asking questions since this has come out, and as the chief said, guidance is constantly evolving. Right now, I will tell you, I don't have a solid answer on that. We thought we did, but the guidance has changed. We're trying to further understand that. What I ask is that each individual that is currently out on leave or out on TDY, I need you to be in touch with your leadership back here at Spangdahlem with your commanders so that we know exactly what your situation is and we can help you get through this situation. There are a number of things that have been explored and ideas out there, but we need to know what's going on. We need to know, ultimately at this point, to bring you back from one of those things, you have to meet one of the three criteria, which is you've got to be mission essential back here. You need to either have a hardship or a humanitarian concern. If you meet one of those three criteria, then we're able to put together an exception to policy memo that goes up to Major General Wood, the 3rd Air Force Commander, and he is the first general officer in our chain of command who is allowed to assign those exception to policies. He has already signed some exception to policies, but there is a high bar that we need to achieve when we're looking at that. I know that this is straining a number of people. We're worried about financial concerns, and we are working through this with you, but you have to help keep us informed on what your specific situation is.
Will Tricare cover any testing for the virus?
So I'm going to punt that one to Dr. Lasky.
Great question. So my name is Dr. Lastly. I'm the Public Health Emergency Officer for Sabre Nation. And the question is, will Tricare cover expenses associated with the virus? It depends on where it's covered, where it's provided. So when it's accomplished within the walls of the military treatment facility here at Spangdahlem, we absolutely process that through our local channels. The test leaves our facility, and then it goes to Landstuhl for testing, and then it goes back to the CDC in Atlanta for confirmation. If a test is procured on the economy, so if it happens on the network, for example, let's say it's after hours here at Spangdahlem and someone contacts the nurse advice line and receives advice from the professionals on the nurse advice line to go and get care off base. And if that person then goes off base and has appropriate care with our host nation experts and they determine that testing is appropriate, then absolutely Tricare does cover that testing.
Thanks, Doc.
Will PT tests still be administered?
So that is something that we are working through right now. I think that there will be at a minimum, we're looking at an initial delay, but I don't want to tell you exactly what that is until we have the policy finalized here. They're looking at it higher levels at Headquarters Air Force as to what we're going to do with PT tests. We're looking at it here locally, but I would anticipate that there will probably be some delays in those unless potentially there's a specific case where it may be required, and then we'll look at doing those on a case-by-case basis. So more information to follow on PT tests.
Will we still be able to bring visitors on base through the visitor center?
Yes, at this time we are not restricting bringing visitors on base. What I would ask in any case though is that you be smart about it. Don't bring somebody on that is exhibiting symptoms or has traveled from a location that requires that 14-day isolation period per the Center for Disease Control guidance. And so if that's one of your family members or friends is over here, I ask you to please follow that guidance, and that will keep all of us safe here. It's really, as we talk about respecting it, I'm really counting on each and every one of you to be smart about what you're doing. If you're feeling bad, you have symptoms, you have issues, self-isolate until you talk to the medical professionals. We properly screen you, we figure out whether we need to test, and then we move from there.
Are FSS facilities remaining open on base, and how are non-food related areas being affected?
So FSS facilities, there are a number of them that will be either having modified hours or be closing. We are putting that list out very shortly. The FSS is finalizing that list, and it will be posted out on both the Spangdahlem Air Base webpage as well as on the app. So if you go to the coronavirus site, it'll have a list of those things that we are canceling. But some of those things include, like the sports programs that we have, some of the FSS service things will go to call in for help unless you actually need to physically be there. The DFAC, as we said, will continue, but it will be to go only. Lodging will continue unaffected. Postal will continue unaffected at this point. The outdoor rec right now, we have rentals, but that is all they will be doing. The food facilities, as we said, are takeout. And then some of the other things will still be open. Right now, Pet Lodge is still going to be operating during normal hours. But things that will eventually close, the one that's probably the biggest one to people is the fitness center, including 24/7 access is going to be disabled. And, I know that is a big stress reliever for folks, but The way that we have talked about and the way we're going through this is if it's a high density, everybody touching all those weights, those are things that we're looking to restrict. Get outside, enjoy the weather. Luckily, we're coming out of winter, and you can actually go for runs, do push-ups, sit-ups, and stuff outside. The library will be is something that will close, as well as the bowling alley for bowling will close, but for food purposes, it will still be open. So you can go for the exhaustive list, and we'll have that out there soon, and we'll have any modified hours as well posted on the website for your use.
Is there a hold off on separation papers being signed? And can those with DEROs during the summer expect their orders to be delayed?
So I can't say, right now we are working on the immediate 60 days, right, where we have the stop moves. I don't know, and I don't think we have had time yet to start planning for how do we come out of this 60 days of stop movement and what delays might be incurred or not incurred. So I don't have a good answer for you at this point. When we get one, we will let you know. And I don't have an answer either on the separations that haven't been signed. What I can tell you is all those that have already been approved for separation and retirement, those are continuing. The additional piece that we just got news of today, because it was going back and forth a little bit about household goods, but for those who have approved separations and retirements, their goods will still continue to get packed out and their goods will continue to get shipped. PCSs won't, although the inbounds, if your goods are here, we are still delivering those on a case-by-case basis to folks.
All right, the next one is for Colonel Lastly. So can you please expand on what we are doing for MDG in terms of telehealth? Is there a plan in place for the medical group as far as teleworking, telehealth goes?
Absolutely. So much in line with the Wing's stance on how we'll maximize telework capabilities, we are working plans this afternoon to adjust staffing schedules at the military treatment facility to maximize teleworking opportunities. Many of our colleagues are able to accomplish their day-to-day work from a remote location, and so we're looking for opportunities to maximize that. But we still have a duty to provide care for our population, and so Colonel Epperson mentioned that earlier. We're adjusting the schedule such that we want to focus on our most acute patients, so those with the most pressing concerns, and we're going to attempt to delay for a short time some of the more chronic conditions or the regular follow-up items. There's also an opportunity to provide some amount of telemedicine in that. So if we can use telephone consults or the patient-physician portal to do that, Relay Health, that's an opportunity to communicate with the healthcare team. And we're going to attempt to continue as much as possible that beneficiary service and provide that medical support here on base.
Okay. What is going to be the process for the individual and the base if someone tests positive for COVID-19?
I'll let Dr. Lastly cover that one. But
Great, absolutely. So if someone does test positive for COVID-19, so if we have a laboratory confirmed case, we would treat that patient with the same care that we would anyone else that had a similar viral syndrome, such as influenza. So they would be asked to return to their home and to get well there in an isolated environment. The concern with COVID-19 specifically is its transmissibility. So it's a contagious virus, and we know that it's passed from person to person two ways. One is contact. So if you shake hands with someone else and then you were to perhaps rub your eyes or scratch your face or your nose, it's possible that the virus could be transmitted to a mucous membrane on the recipient, and then the recipient would become sick. So contact is one way that we're concerned about COVID-19. Another way that we're concerned is respiratory droplets. So that's why we care a lot about coughing and sneezing. And so if cough etiquette is is very important. We want to remind people that if they need to cough or sneeze, that they do so into a tissue and they throw the tissue away afterward. It's not to be reused. Alternatively, they can cough or sneeze into the elbow of their arm. And what that does is it prevents the respiratory droplets from being aerosolized and then someone nearby from having contact with those droplets and then perhaps getting the virus that way. So just like we would with influenza, we have a person who would test positive, they would return home, they would isolate, they would try to prevent the transmission of their condition to one of their family members or their roommates. And of course, we have a duty to report that information through public health channels so that we can monitor their recovery and also help try and prevent the spread to other people.
And sir, on that note, if symptomatic, will civilians not on Tricare be seen at the clinic?
I'll have to investigate that answer a little bit more. I think that personnel who are normally entitled to care are able to be seen in a normal fashion. But I don't think there are any changes to the rules about us being able to see people who are not normally entitled to care. But I'd have to defer that one to the experts.
All right, thank you, sir. Can we get our stuff back if we picked up but not shipped? But if it was picked up but not shipped?
I will have to talk to the LRS about that. I'm not sure at this point what that capacity is to do that.
Okay. Dr. Lasley, did you make mention of the quarantine period? There was a question here regarding 3-day quarantine instead of the 14-day quarantine.
Absolutely. We fielded a lot of questions about this topic. There are two different restrictions of movement. One has to do with personnel moving from country to country or traveling, and that's the default 14 days. There is another restriction of movement or self-isolation initiative which we pursue when someone becomes ill. And so if there's an individual that comes down with influenza-like illness or influenza-like symptoms, then we encourage that person to go home and isolate with concurrence of their supervisor and their leadership chain. If they are seen for medical care, such as if they were to call into the public health hotline and go through the triage, if they are thought to be a high-risk patient for COVID-19 at that time, the call is transferred to one of our clinical nursing experts who continues the triage. If the clinical nurse, through the algorithm, continues to be concerned, then it's reviewed by the clinical care team, and people may be placed on quarters if that's necessary. Now, quarters do have a maximum of 72 hours, and so, but with this particular condition and our concern about its transmissibility on the base, we're leaning toward the full 72 hours where we're able. If those need to be reviewed, people can call back into the public health hotline. We'll get an update on how they're doing, and then we can go from there.
Thank you, sir. So one more with regards to the public health hotline. So let's say what are the consequences if someone from base has been in contact with a person who tested positive for the contravirus but didn't let the 52 MDG public health hotline know?
There's always a concern about spread of the virus. When someone perhaps becomes infected with it but doesn't report it. The thing that we care about the most here at Spangdahlem are symptoms. Symptoms are really, I think, the most objective data point that we have in whether someone is infected with an illness. And most of the time, someone has an illness of this sort, it's not COVID-19. Most of the cases are actually either a head cold or, like I said, some strain of influenza, being that it's flu season. But where there's someone who had become exposed to perhaps a laboratory confirmed case and had not reported that yet, we would certainly like to take the information at the public health hotline so that we can help triage the case and help with appropriate decision making.
Yes, sir. Are you at all able to speak on how many tests have been administered so far, if any?
Absolutely. So we have administered a number of tests here at Spangdahlem. I don't have the exact number, but as Colonel Epperson said, they have all returned negative so far. And we do get an update on those about twice a day in terms of where we are and what the need is. We're also focusing our testing based on CDC guidelines, trying to make sure that we administer and offer the tests where patients have a need, and that need is determined based on symptomatology. So what is the constellation of symptoms that someone is experiencing? A lot of times with a good history, we can help people flush out if it's a head cold. If they have nausea, vomiting, diarrhea, it's much more unlikely that it's COVID-19. It is possible, but it's more unlikely when those symptoms are present. We focus on the temperature that's 100.4 degrees Fahrenheit or higher in conjunction with a cough. Typically the cough is dry instead of wet. And also in patients with a severe, like a shortness of breath. So people can experience some shortness of breath, especially in our older population. But again, GI-related symptoms, nausea, vomiting, diarrhea, fairly rare so far. So in terms of testing specifically, another angle that we are taking is we're focusing on organizations. So if we have a large number of personnel in a specific organization, we're very interested in that, and that will help us determine, is there something being passed among the personnel that we can help with from a public health preventive medicine approach.
Thank you. This one is with regards to the CDC. So will payments be suspended in the event of a closure of the CDC?
So we are closing the CDC. The CDC is closing as of close of business this Friday. At that point, yes, all payments will be suspended for the CDC.
If a dorm airman tests positive for the virus, will they be quarantined in their dorm? And what will their food situation be if they eat at the DFAC?
Okay, so there's a number of things there that we're looking into. The first one is if you're in that self-isolation period, that is a point where we want you not sharing bathrooms and other things. So for most of the dorm residents where you have a shared restroom, we are looking at alternatives of either putting you in a different dorm room or moving them to a different location. Part of that will depend upon how many cases we get with people that start to exhibit those symptoms. The second thing is, we have the guidance that is out there on the self-isolation. At this point, it is not a quarantine, it's a self-isolation. So food can be brought to you, or they can go get food as required and bring it back. They're asked to limit their interaction with folks when they are out of their room and keep their physical distance as well as good hygiene practices as they're out there. But clearly, if we get a number of cases, we're looking at what those alternatives are on how we can help continue to provide that care.
And if I could, sir.
Absolutely.
And to add on to that, once they do become a laboratory confirmed case, so if we draw the test and it returns positive and we have evidence of an infection of COVID-19, then we do recommend that person restrict their movement even further because they are infectious to the folks around them. So in that case, we would ask, if it were to happen here on Spangdahlem, we would ask that the organizations rally around that person and help drop food off and Tylenol, Motrin, Gatorade, that sort of thing. And that helps prevent that person from having to get out and about to take care of their own concerns.
That's great. And yeah, we'll absolutely work closely with first sergeants and command teams at that point to make sure that everybody is getting what they need if we get a confirmed case.
Can members be tested if they have all the symptoms but have not come from a level 3 country? For example, a member returning from the States but having the symptoms.
So I'll let Dr. Lastly cover this one, but the bottom line is if you are exhibiting symptoms, we need you to call the public health line. They will walk you through a number of questions and they will make an assessment and figure out whether it is appropriate to test.
It's a great point, because deciding how to accomplish testing in a way that serves our population the best, and also our personnel and their families, has been something we examine every day. The focus that we want with the testing, accomplishing the testing, we'd like to be able to provide information that's helpful in the care of that patient and also in the health of their organization. So,
Has there been discussion on opening up a separate testing location away from the main clinic?
there has been discussion on accomplishing that. We have looked at options for if we had to begin mass testing of personnel on the installation. We're looking at what sorts of facilities could we use to carry that out. But at the present time, it's not required. We're making our testing decision based on the individual that presents, and also based on, is there a clustering within the organization? Is there a high number of people in a small area, for example, that have symptoms that are concerning for COVID-19?
Will the chapel services and masses be canceled?
So we will not have those services in, they'll transition to a virtual format moving forward. Again, that comes in line with enough, large gatherings. We are coming in line with the new Center for Disease Control guidance on that. And so, yes, those will be suspended in person, but the chaplain cadre here is looking at how they will do those virtually in order to be able to continue to provide the ministry and care to our airmen.
So just to follow up again with the CDC, for our viewers who are just joining us, a question that keeps reoccurring is, will we be reimbursed or credited for the remainder of the months we've already paid for at the CDC?
So I can't get into the exact details of how that is going to be paid back or how that will be suspended. At this point, all I can tell you is that we have discussed that, and the FSS, who runs that through the non-appropriated funds, is looking at how they will do that. We'll get orders to
How does the med group make the decision if someone can have the test as a flu or as the coronavirus if they're exhibiting the same symptoms?
So it's tough being able to flush that out, because we don't know when we see a patient if they have influenza or if they might have COVID-19. What we know is that among our population, we think that the likelihood of COVID-19 is very low. And that's based on both our testing on base and also what we're hearing from our partners off base in the public health departments. We have daily chats with the public health departments in each of the surrounding areas, and they're able to communicate with us what their testing load has been, how many cases are in the local area. Colonel Epperson mentioned that earlier. And that allows us to make a risk-based assessment of what our population may be facing here at Spangdahlem. For the majority of patients that have influenza-like symptoms, they actually have influenza or a severe head cold, some other sort of virus. It is also possible to have one of the other types of coronavirus. For example, there are several coronavirus types that have been in existence for a long period of time, and it's much like having the flu. It's just not actually influenza. We want to be careful that we are focused on the novel influenza virus, or excuse me, coronavirus from 2019, which is the focus of our attention today. Flu testing as a first, a first testing option for our patients when we have a question about, does this person need to be tested, and will it alter our treatment for them? We may pursue testing in a way that would allow us to first identify influenza with the rapid flu, and if we still can't find any sort of positive result, it may be appropriate to continue testing after that on a case-by-case basis.
What would constitute the move from HP-Con Bravo to HP-Con Charlie?
I'm going to kick that one again to Doc Lastly. There is very specific, definition of what those different HP condition levels are, and we are abiding by those, so that we know when we can go up and we can go down. I know that there were a lot of questions of when will we see. Sorry, I'll let the sound of freedom go for a second. I know there were a lot of questions as to why we stayed in HP condition alpha as long as we did, but the trip there was either whether or not we had somebody within our population get it, or if we had an increased risk in the surrounding area, and we didn't have that increased risk until the increase in the cases in the local population over the past 24 to 48 hours.
So the HP-Cons or health protection conditions are something that many of us are not very familiar with. We're more familiar with FP-Cons perhaps, or hurricane conditions. The HP-Cons are assigned at the local installation based on the risk as we see it, and we try to review that once or twice a day at least. And as I've spoken before, we base it on what we see as the caseload on base, and also we look at what's happening right outside our gates. And so what happens here at Spangdahlem is, and has been, different from what we see with our partners at Ramstein, Aviano, Lake and Heath, places like that. They are also looking at their own populations and the concern that they do or don't have right outside their gates. And so it is made every day and reviewed every day as we look and see, like, how restrictive do we need to be in terms of recommendations for our population. As the HP-Con has potential to go up or down at any time, we know that as it goes up, as it increases, that decreases the closeness that we as a population can have with each other. Because the intent with increasing HP-Cons is, of course, to decrease risk of disease transmission. And so we want to be appropriately cautious in how we make recommendations for HP-Cons without overly burdening our population. And so, as Colonel Epperson mentioned just a moment ago, with the increased cases right outside the, not right outside the gate, but in the community outside the gate, we want to be appropriately cautious, and so we recommended elevating the level to Bravo. For us to get to Charlie, perhaps a large number of cases that appeared in a short period of time, that would be concerning to us. If we had an uncertain number of cases inside of our gates and on our installation, that will be concerning. It's really we just have to kind of take things as they go and look at all the data points and then make a risk-based decision as best we can.
If food service locations are closed to include the club and bowling alley, will the employees still get paid?
So at this point, we are not closing food service locations. The food service locations are remaining open. We are just making them to-go items only. We have not discussed what will happen if we have to close those, because we're not at that point yet.
If I had made an appointment and there are plans that appointments get canceled, are there plans in place to have them rescheduled?
Yeah, great question. And we've actually been working through some of that this afternoon. And so some of our appointments we're trying to lean forward on. It may be possible that you're contacted by your team in hopes of seeing you sooner than you were scheduled. So we're looking at that option for some of our patients. For some of our patients, we're going to try and accomplish or meet their needs by telehealth or telephone consult. So we'll see which patients that are booked, we might be able to help them out over the telephone. And then to the smallest extent possible, there may be some rescheduling required, but we're doing our best to try and get ahead of that and avoid that requirement.
Could you go over the social distancing and preventative measures again? Some people might be confused on how to limit the spreading exactly.
Okay, yeah, and the way as I said, the way I like to think of it is actual physical distancing. You want to keep a barrier between you and your fellow airmen, and that's a barrier of space, really. And so you can get the specific details are outlined on the letter that I sent out earlier today. But we're looking for you to remain a minimum of 2 meters or 6 feet away from other personnel, so that you're not grouped closely together and touching people. You should avoid contact, so no more handshaking, fist bumping, elbow tapping, especially if we're busy coughing into our elbow. We don't need to be tapping that with somebody else's elbow. So avoid those things. Keep air and space between you and your fellow airmen. The next thing is make sure that you're cleaning yourself, right? Good hygiene. Vigorous hand washing for 20 to 30 seconds with soap and water. If for some reason you don't have soap and water available, then you can use hand sanitizer with greater than 60% alcohol content, but your primary should always be soap and water for washing your hands. Commonly touched items, start to wipe those off. You'll notice that if you went to the gas station on base yesterday, they have sanitizing wipes, and they're wiping off the counter regularly. They're wiping off the credit card touchpad. They are doing things in order to make sure that all the commonly touched things are kept clean and disinfected. Okay. The next thing is avoid large gatherings, because when you're in large gatherings, you're going to get tight and you might have unintentional contact. So we're gonna move away from that. The next thing that we're going to do is start to adapt some of those teleworking and other things so that we don't have our workspaces as crowded and we're not exposing everybody in case one person does bring the virus into our population. We protect those that aren't here. Anything to add to that, Dr. Lashley?
That's great, sir. The only thing to add on to that would be when you're selecting how to clean your common touch points and your work surfaces like desks, common household cleaners are great. You don't have to buy the fancy, expensive cleaners that you might see out there. Just standard home cleaner. Follow the package instructions and increase the frequency that these areas are cleaned. Things like doorknobs, sink handles, keyboards, things like that. We may not think about it from day to day, but that's how germs are transmitted quite easily. So thank you.
If a person coming back from TDY, where there is a large number of people with COVID-19, and they start their 3-day quarantine today, what is the plan for the shop that they work with upon that individual's return?
So first of all, if you're coming back from a Center for Disease Control declared level 2 or level 3, you're supposed to go into 14 days of self-isolation. When you come out of that 14 days of isolation, then you'll go back into your normal work environment, because then we will have gone through the normal gestation period of this virus, and we'll know that you don't have it, and so now you're good to go back. While you're in that time period, you should be engaged with your leadership, with your command team, to make sure that they know, and they should all know, and they are providing me products of the status of each and every one of you that is either currently on leave or TDY, or has come back from a location and is currently in a self-isolation period. as well as if we get to a point where we do have to restrict movement even further if you are, tested positive for it, then we'll have that information as well. But all I can encourage you to do is make sure that you keep open lines of communication with your leadership teams and let them know what's going on and stay in touch. If you start to exhibit symptoms during those 14 days, that's the time to call the public health hotline and to start going through and getting the assessment, and we'll do the screening to determine whether or not you are somebody that we should get tested, and we'll move forward from there.
Will the med group begin providing quarters to airmen with flu-like symptoms? I know you mentioned the 3-day rule. However, supervisors are only able to provide 24-hour quarters.
Great question, absolutely. And so the key, it's hard to overemphasize this. The key is absolutely prevention. So we're encouraging supervisors and commanders at all levels that when their personnel are truly ill, that they are able to send them home on basically just send them home. It's like quarters, but it's not officially quarters. Supervisors can do that for 24 hours. At the end of 24 hours, they can touch base with their personnel, and if they are still ill, they can renew that 24 hours, keep them home for another day, and then another day. That's certainly possible. If there are concerns in the supervisory chain and medical review or evaluation is requested, we're delighted to offer that. Again, it's the public health hotline at 452-8308. They've been very busy today, and they are glad to take your calls. What they want to do is provide appropriate screening and triage to the personnel. And then if there is a concern for illness still after the questions, then they'll absolutely put in quarters. Again, they go for the 72 hours just because it's easier to knock out 3 days all at once and then allow that recovery at home. And then at the end of the 3 days, the supervisor can extend that another day, and if there are still concerns, then we'd be delighted to put in another 3 days of quarters by telephone if the patient is still symptomatic.
So the key in all of this is communication, right? That's what we've been talking about. You need to communicate with your supervisory chain. You need to communicate with public health if it's something that starts to go into a question where you're not sure. Keep those open lines of communication going, and that's how we'll know what the proper actions are and what we should be doing. We're absolutely going to do what we can as we move forward to prevent the spread and prevent exposing people to things unnecessarily, especially during the time period where we don't know if this is exhibiting COVID-19 or something else along the ways. Okay, I'm getting the thumbs up that that's all the questions for today. I will tell you that so we're going to be back here on Thursday at 1500 to continue to ask your questions. I'm sure there will be lots of changes between now and then. I did write down about 5 questions here that I owe you answers back to. So we will get the appropriate experts researching the answers to those questions. We'll provide those back out via Facebook. If when we are able to get them, we'll post them out there so that they are available to you, and they'll probably get added into the rest of where Public Affairs is posting this stuff. Chief, you have any last comments?
Yeah, just again want to say thank you for your thought-provoking questions. There's, we appreciate folks looking for nuanced answers and looking out for each other. So just continue to do that. Continue to take care of each other. Continue to make sure that you're fully informed and just kind of stay in touch. Things will change, no doubt, but we look forward to getting to the other end of this together.
All right, so thank you, Chief, and thank you, Dr. Lastly. I appreciate your guys' help in fielding the questions and answering, really deep concerns that each and every one of you have. We know that these are personal questions. We know that they're affecting each and every person here differently, but we are in this together. We're going to get through this as Sabre Nation, as a team, and as a family. That's why I'm in favor of physical distancing, not social distancing. Continue that open communication. Continue to talk to each other. Just do that in safe means with physical separation from each other. This is all about respecting COVID-19. We don't need to fear it, but we do need to respect it. We need to have you follow the precautions that we are taking as we step up to Health Protection Condition Bravo, and please cooperate with us and think of the intent of what we are trying to do here. If you always bring yourself back to the intent of, protecting Sabre Nation, limiting the spread, and preserving the mission, that is going to be a good way for you to make decisions as we move forward. Thank you for all that you're doing. I know that this is trying times for each and every one of you, but I appreciate the service of you and your families to our nation and to the rest of the world to keep it a nice and safe place. Just help us keep it a healthy place as well.